Welcome to Daily with Doc and Becca. This program is for educational purposes only. The statements in this program have not been evaluated by the FDA. The content is not intended to diagnose, treat, cure, or prevent any diseases, nor is it intended to take the place of your primary care physician. Testimonials are shared as individual experiences of the individual sharing their testimony. Results vary and may not be typical. We do not make any claims regarding health or income. As an empowered individual, you do have options available. We are honored to have a founding father of the science of epigenetics guiding us with the best options to obtain or maintain optimal health, Dr. Joel Wallach. Hello, everybody. Welcome to Daily with Doc and Becca. My name is Becca Dukes, and I am super excited to be able to bring this program to you with empowering information to put into your toolbox to help you choose a better health journey. Here on Daily with Doc, we are sponsored by dailywithdoc.com, where you'll find information in regards to good foods, bad foods list, our previous programming, additional articles to help you with those choices. And for those of you who are not working with somebody, we also have a store there with the products that we talk about on this show. These products they're solutions that we have all found to be the solution to many of the problems and most of the problems that are affecting us around the world, because when there's over 90 essential nutrients and almost 10 poor health conditions associated with the deficiency of each nutrient, that's like 900 different poor health symptoms, folks. That's just because of nutritional deficiencies. And in many times, there's more than just one deficiency. So we address the body as a whole, looking at the body as a whole, and making sure that we are recommending products that do just that, treating the body as a whole with information that can help you not only through nutrition, but also things to think about. Now, this program, like I said, is being sponsored by Daily with Doc, but we are an amazing resource for a community of individuals who are health coaches, certified holistic health coaches, health practitioners, even, a practitioner, doctor, there's so many different people in the medical field that are opening their eyes to the value and seeing that, yes, indeed, nutrition is key and so very important to helping us as individuals have a better health journey. Now, get back with the person that shared this program with you if you were referred to this program by somebody specific. Because we are that resource, we want to make sure that we keep the integrity of this program and have you get back with them. For those of you who are not working with anybody, were not referred to this program by anybody, and have not tried any of the products that we are talking about on this program, I do have a call team available just for you at 855-949-3377, where you can get in contact with a certified holistic health coach today, as we do have around-the-clock services. Today is Friday, folks. One of my favorite days, as it is Pharmacist Friday here on Daily with Doc. And today we are going to be looking at the skin you're in and unpacking the body's largest organ with Pharmacist Ben. Why Pharmacist Ben? Well, folks, Pharmacist Ben has been practicing. He's a nutritional pharmacist. He's been working with the skin for decades, from the inside out, outside in, and I can't think of a better person to be sharing with us information about the skin and what we can do to support it. So, Pharmacist Ben Fuchs, welcome to Daily with Doc and Becca. How are you today?
I'm great. How are you today? Nice to see you. I am
doing just fantastic.
So the skin, huh?
I love skin.
It's so amazing.
It's not just like a bag that everything fits in. It's an organ.
That's right. Why is it that we're so focused on the skin? You know, people care more about the skin than any other organ of the body. Why?
Because that's what we see.
Yeah, it's the part we see, right? That's the part everybody sees. The thing about the skin is like a canary in the coal mine. It gives you a rapid window into what's happening inside the body. It's extremely rare, despite people's beliefs, for something to happen on the skin, for something to show up on the skin that's caused by something on the skin. It does happen. You can have infections. You can have what are called contact reactions. Contact dermatitis is, for example, reactions to things like latex or nickel or gluten. But even then, the immune system has to be destabilized for those things to show up. And that's a very important idea when it comes to skin health, is that the skin is an immune organ. It's a defensive organ. So defensive responses, which are responsible for pretty much all health challenges, that's why we call them inflammation or inflammatory. Defensive responses, which are responsible for all health challenges, are also responsible for skin health challenges. All skin health challenges are based in inflammation, based in defensive responses. How do defensive responses get initiated? Logic, not medicine, not science. Logic tells you a defensive response gets initiated by an offending agent, period. End of story. Now, offending agents don't always cause a defensive response, but they will cause a defensive response if the offending agent is severe enough or potent enough, or if the system is destabilized already, either by nutritional deficiencies, lack of oxygen, or toxicity, which are the three causes of cellular disease: toxicity, starvation, suffocation, starvation, and toxification. So let me repeat that. Real quick. Skin conditions are almost always, with rare exceptions, defensive responses. Those defensive responses occur, obviously, to offending agents. The offending agents only cause or trigger defensive responses if A, they're significant enough. I mean, it's not just any offending agent will necessarily cause a skin reaction. They have to be strong enough or potent enough. Or the system is destabilized by starvation, suffocation, or toxification, or a combination thereof. I'll say it one more time. Skin reactions are internal or start internally, even though they show up on the skin. That's the first thing we want to get across in our heads. Skin reactions start off internally. They start off internally as the manifestation of a defensive response to an offending agent. The offending agent will only trigger a defensive response if A, it is strong enough and potent enough, or B, the system is already unstable because of starvation, suffocation, and toxification, or a combination thereof. Does that make sense? I know it's a lot of stuff. Bottom line is skin, like all health challenges, where you see the problem is not where the problem begins. Where you see the problem is not where the problem begins. Where you see the problem is not where the problem begins. Mantra. Where you see the problem is not where the problem begins. the exception of the digestive system, because if you eat the wrong food, you're going to feel it. Aside from that, where you see the problem is not where the problem begins. Of all the medical specialties, the silliest and the most unsuccessful is dermatology. Why? Because the dermatologist is treating the end. He's treating what's called the resolution. The pimple is the resolution. The rash is the resolution. The itchiness is the resolution. The whatever you're treating is the resolution. It's the end. It's the excrement. It's the way the body has handled the problem. The pimple is the way the body has handled the starvation, suffocation, intoxication, and the offending agent. So all disease should be regarded as the end result of something that's happening inside the body. Dermatology is the icon of that idea because the skin is the most extreme part of the body. It's on the furthest outreaches of the body. You go to a dermatologist today, and by the way, I love my friends who are dermatologists. No knock on them. They're good people. It's no knock on them personally. It's the paradigm. You go to a dermatologist, you're going to get an antibiotic or you're going to get a steroid. Today, they have some fancy immune suppressants that imitate steroids. They're a little bit not quite as deadly as steroids. They call them biologics. So you get a biologic / steroid, or you'll get an antibiotic. If you went to the doctor, the dermatologist in 1960, guess what you would get? Same thing. Their tools have not changed because there's nothing they could do. You can't treat the end result. AJ, you can't treat the fruit. You got to treat the root. And this is the problem with how we treat the skin. When we see something on the skin, we naturally say, okay, it's a skin thing. I'm going to go to a dermatologist. He's going to take care of my skin. We don't understand this basic concept because it's not intuitive. That's why you got to come on these calls. That's why you got to listen to my talks. That's why you got to kind of take a deep dive in how pathology shows up. Where you see the problem is not where the problem begins. The good news about the skin, in addition to the fact that it's a portal to the inside of the body and give us an assessment of what's going on inside the body, is it corrects itself quickly, really quickly. Only the digestive system corrects itself as quickly as the skin. That means if you have something going on in the skin today, you don't have to have it in a week to 2 weeks from now, or even less, depending on how immediate the reaction is. So skin issues do not start off on the skin. They show up on the skin with rare exceptions, as I said, contact issues. So that's first point number one. The second point about the skin is you don't want to hide a skin symptom. You want to understand a skin symptom because it's giving you very important information about what's happening inside the body. So the most common skin issues, aside from aging skin, which is not really, it's more cosmetic than a pathology, are dry skin and pigmented skin. Those are the two most common complaints about skin. Acne is probably third. So let's tackle dry skin first. We sell $10 billion a year in moisturizing creams in this country. If I were to look at everybody out there and say, how many of you people have dry skin, and you were being honest about it, every single person who's an adult would raise their hand. Every one of them. I said who's an adult, and that's very important because kids don't have dry skin, with some exceptions. For the most part, kids don't have dry skin. For the most part, it's an adult issue, and for the most part, it's a condition that gets worse as we age. What does that tell us? If kids don't have something, adults have it, and it gets worse as we age, by definition, it is a degenerative condition. It's getting worse. Degenerative means it's getting worse. So dry skin is a degenerative condition. How do all of us treat our dry skin? We wear, or we put on, I always do this when I say this word, which I hate this word, so I have to do this.
A moisturizer?
Moisturizer. Always do this, moisturizer, because there ain't no such thing as a moisturizer. If you take a sponge that's dry and you put it under the faucet and it gets wet, it's now moisture. water's moisture, so that sponge is now moisturized. Does your skin feel like a wet sponge when you put your moisturizer on? Of course not. It doesn't feel anything like a wet sponge. It doesn't feel anything like moisture. It doesn't feel anything like water. In fact, the reason why we wear moisturizers is because we don't know when we have dry skin. You cannot tell when your skin is dry. You can only tell when your skin is rough. And we collapse these two separate ideas of rough skin and dry skin into one pathology or one health issue. And because we think they're the same thing, we put softeners on the skin and call them moisturizers. Moisturizers are not moisturizers. They're slickerizers. They create a slick sensation on the surface of the skin that we, through hypnosis, perceive as moisture. And every woman out there listening, not so much men, but men too, have said, oh, I put my moisturizer on and now I'm moisturized. Because we collapse rough skin with dry skin. Now, this is not semantic, and I'll tell you why. When we soften the skin, instead of hydrating the skin, we have not changed the water balance of the skin. And the water balance of the skin, the water level of the tissue, is how the tissue stays healthy. And the amount of water in the tissue will determine the likelihood of skin cancer showing up, the likelihood of skin diseases showing up, the likelihood of accelerated aging showing up, the likelihood of hyperpigmentation, melasma, darkening of the skin showing up. The likelihood of all other skin pathologies is tied into the water balance of the skin. And when we soften the skin and think we're changing the water balance, we haven't changed the likelihood of skin cancer. We haven't changed the likelihood of skin disease. We haven't changed the likelihood of melasma or hyperpigmentation. We have not corrected the water balance because we haven't changed the water balance. All we've done is soften. And this is why hydration is so critical, not because it's comfortable, but because it's healthy. Xerosis or dry skin is not a discomfort or cosmetic concern, it's a health concern because xerotic or dry skin is more prone to skin diseases, including cancer. It's even worse than that because moisturizers not only don't moisturize, they actually suppress the skin's ability to moisturize itself, making dry skin worse. Your moisturizer is making your dry skin worse. So not only is your moisturizer not helping, it's making things worse. Not only is your moisturizer not reducing the risks of dehydration-related skin pathologies, it's making them more likely. How many of you guys notice that the more lotion you need, the more lotion you use, the more you need? And a classic example of this is the lips. The lips are super skin. Why? Because the lips are sticking out. So nature has equipped the lips with extra protective factors, extra skin hydration factors. But I should probably tell you this, in the surface of the skin, surface of the lips or skin anywhere, you have little molecular sponges that suck water up from the atmosphere and suck water up from the bottom levels of the skin. They're called the natural moisture factor, and your lips are especially packed with natural moisture factor. But the more covering up you do, we call that in the skin business occlusion. The more occlusion you do with your chapstick or Blistex, and you know I worked for Blistex for 4 years in college, the more chapstick or Blistex you use, the more you need. And there are people out there listening to this video that know they can't go 10 or 15 minutes without putting chapstick on because they've so suppressed their natural moisture factor by constant use of chapstick. Now they're not making any, and as soon as the chapstick wears off, their lips are incredibly dry. The same phenomena happens with the skin. This phenomenon of xerosis and dry skin being exacerbated by our treatments, this phenomenon of xerosis or dry skin not being addressed correctly at the causal level is an icon. It's representative. It's a poster child for what's wrong with how we treat the body internally, as well as how we treat the skin. By the way, how does the skin stay moist? How is the skin supposed to stay moist? What system in the body naturally moisturizes the skin? Have we talked about this before? Where does the moisture come from? When your skin is normal, when you're a baby, when you're a teenager, when you're a kid, and you have normally soft, moist, hydrated skin, healthy skin, where's the moisture coming from?
Is it coming from what we...
Where in the body is it coming from?
Not the digestive system?
Close. Everything comes from the digestive system eventually.
Circulation system?
Bingo.
Sorry?
Bingo. It comes from the blood. Your blood circulates around the body, and as it comes to the skin, it branches off into very, very tiny blood vessels called capillaries. Capillaries are extremely tiny, and as the blood is going through the capillaries, water comes out of the capillaries, water, and then that water rises up to the top through diffusion from the bottom layers. And by the way, the skin is layered. Even though it doesn't look like it, it's layered. It comes up from the bottom layers towards the top, and that's how it's supposed to stay hydrated. This all depends on effective blood circulation. What do we say about pathology, about disease? All disease is cell disease, and all cell disease is preceded by
dirty blood.
Dirty blood. Dry skin is a blood issue. It's a dirty blood issue. It's because the blood's not circulating effectively. It's because the blood is not fluidized effectively. It's because the vessels, the capillaries are not healthy, like all issues. And that's why you can smear all the darn moisturizer you want on your skin. It ain't going to help if your blood is sludgy and sticky and dirty. And this is why, as we age, our skin gets drier. You follow me here? Now, in addition to moisture diffusing upwards from the bottom to the top, there's another very interesting phenomenon that keeps the tissue hydrated. Nature, God, the divine force wants the tissue hydrated for health reasons, not for beauty reasons, not for comfort reasons. So the system is set up to be healthy. And so under healthy conditions, the blood circulates, water leaves the capillaries, it rises up to the top. Along the way, the water is held in place. It's trapped. It's locked into place. Some of it diffuses upwards, but much of it, as it's diffusing upwards, gets locked into place. That water that gets locked into place is no ordinary water. It's magic water. It's structured water. It's called easy water. Easy stands for exclusion zone water because this kind of water is separate from everything else. It has its own characteristics. It excludes everything else. It's pure. What is it that locks that water into place, that structures that water, that makes that water super water or what I call magic water, which is an extra hydrating form of water that is intelligent, that has information processing capabilities, that passes light and communication, electricity through it, through its molecules in a coherent way, like almost like a computer chip. What is it that locks that water into place? Connective tissue, collagen, and polysaccharides like fucoidin, and hyaluronic acid, and glucosamine. Excuse me. All of these connective tissue molecules, whether it's the proteins in the connective tissue or the gel in the connective tissue is made up of proteins and gel, fibers and goo, I call them, lock the water into place. Hyaluronic acid famously can lock up a gallon of water in a teaspoon of hyaluronic acid can lock up a gallon of water. As we age, guess what happens? Our hyaluronic acid deteriorates, our collagen deteriorates, our connective tissue deteriorates. Water doesn't get held. That's why we sag and get thin, in addition to having all the health problems associated with deteriorating connective tissue and a lack of water. And there ain't a moisturizer on planet Earth that's going to make a difference. All of which is to say that are something as benign and seemingly insignificant as dry skin is indicative of a major degenerative issue. This is why none of our skincare or topical skincare products work unless they're nutritionally based, unless they're vitamins and minerals and fatty acids and amino acids, which work by nutriating the cells. So if you have dry skin, you want to be nutriating the tissue with topical nutrients, and you want to be building the connective tissue with your Healthy Bone and Joint Pack. And I don't know when I heard anybody ever say the Healthy Bone and Joint Pack is one of the best skin moisturizers or natural skin moisturizers you could ever use, but it is. And that's one of the reasons why I like the Healthy Bone and Joint Pack so well, is because it builds the body globally. This is just one health challenge, one skin health challenge I'm pointing out. There's many of them. Rosacea, another one. Rosacea, everybody who has rosacea out there knows there's certain foods that trigger their rosacea. Yet, we still think we could put a cream on our skin and take care of our rosacea. Acne. There are people out there that think a product will cause acne. I put my product on my skin broke out, I got acne. Not understanding that acne, like all other skin issues, is the end result of an offending agent in combination with starvation, suffocation, and toxification. In the case of acne, you have holes in your skin. I call them rabbit holes, but technically they're called follicles. But you can think of them like a rabbit hole in your skin. And the top of the rabbit hole has an opening called a pore. And your skin's covered with pores and follicles, or openings and rabbit holes, any way you want to think about it. The rabbit hole, or the follicle, sometimes will have a little oil gland in it called a sebum gland, or sebaceous gland. And that sebum or sebaceous gland pumps out sebum and oil, and that oil is supposed to keep the skin soft and prevent water from leaving. It has antimicrobial properties. It's very important stuff. Sometimes you'll have a hair in there, and that's called a pilosebaceous unit. Pilo means hair, sebaceous means gland, and you have a follicle. The follicle, the rabbit hole, is lined, like every other part of the body, is lined with cells. When those cells divide rapidly, guess what happens? You get a plug. If there's also sebum or oil, you get a blackhead. If there are bacteria that are trapped inside, because there's bacteria in your skin, you get a pimple. Acne is caused by a trifecta of rapid division of cells inside a follicle in combination with sebaceous secretions, in combination with trapped bacteria. Nothing to do with skincare products. Skincare products will not make you break out, with the exception of skincare products that irritate the follicle and cause the cells to divide rapidly, but that takes weeks to show up. That's called comedogenic. And skincare companies will look to see if their products are comedogenic. And that takes 4 to 8 weeks to show up, because it takes 4 to 8 weeks for the cells to divide rapidly enough to clog the pore. So if you have acne, the question to ask is, what's causing the cells to divide rapidly? Because that's what the initial cause is. The cells are dividing rapidly. Well, what other disease do we know of is caused by cells dividing rapidly? Cancer. What is it that makes cells divide rapidly? Starvation, suffocation, and toxification, the same three things, the only three things that cause all cell problems. So for acne, you've got to feed the system, particularly with nutrients that help cells grow at just the right rate. The most famous and important one is vitamin A. And everybody out there who has acne has probably used a vitamin A product for their acne called Retin A, or retinoic acid, or retinol. What does retinol do? Retinoic acid, Retin A, stabilizes the growth of cells. You can also slow down the production of sebaceous secretion, sebum. What is it that causes sebum to be secreted rapidly? Stress, cortisol. Sebum and skin oils, sebaceous secretions and skin oils are part of the body's defensive responses. Sebum is the end result of a defensive or stress response. One of the most important stressors, sebum-initiating stressors in the body, is sugar. And this is one of the reasons why acne is called skin diabetes. In fact, when I was in pharmacy school back in the old days, we used to use diabetes medicine to treat acne. And you can still do it. You can still use diabetes medicine to treat acne. There's also the insulin connection, and insulin is a potent sebaceous secretions and stimulation of cell division. You have two of the major features of acne. If you try to use an antibacterial, such as tetracycline, which is what everybody gets, or clindamycin topically, which is what people get, you're going to kill the bacteria, but you're not going to change the acne, because the bacteria is the end result. It's the last stage in the development of a pimple. The best treatment for acne is going to be vitamin A and getting rid of dead skin cells, exfoliation, using something like alpha hydroxy acids. And by the way, retinol, or retinoic acid, or retin A does both exfoliate and stabilize the growth of skin cells. And then we come to probably the most important complaint among older people, women, which is hyperpigmentation, dark spots, or melasma, they call it. It is notoriously the most difficult skin condition for estheticians to treat. And as anybody out there who has hyperpigmentation can attest to, it's almost impossible to address topically from a permanent standpoint. Why? Because pigmentation is a protective response, like sebaceous secretions. It's a sign that the body is in protective mode. Think about a tan. What is a tan doing? That's a type of hyperpigmentation, except it's more uniform. It's a protective element. It's a protective mechanism against the sun. So when we're under duress, the entire protective system kicks in, and that includes pigmentation. Now you'll notice, little kids don't hyperpigment. So if you're one of those people who says, I can't go out in the sun because I hyperpigment, you're placing the attention or the blame on the wrong stimuli. Kids are in the sun all day long. They never hyperpigment. Why is it that older people hyperpigment, particularly older women? Because we are sending signals to the brain, which is ultimately responsible for pigmentation. We are sending signals to the brain that we're under duress. These signals to the brain that say we're under duress and tell the skin to pigment are mediated by two chemicals, two hormones. And these are the two major hormones responsible for melasma or hyperpigmentation. Estrogen, which explains why it's mostly a female issue, and cortisol, stress hormone. And the reason why you can't get rid of hyperpigmentation is because as long as your body, your brain thinks it's under duress because you're sending its signals via estrogen and cortisol, it's going to pigment. You can't stop it. The only treatment for hyperpigmentation topically is to burn it off with either a laser or chemical peels or topical skin lightening agents, including the aforementioned retinol and retinoic acid or alpha hydroxy acids. But it's going to come back until you control the signals being sent to the brain by estrogen and cortisol. And any woman on the birth control pill knows that that's one of the things that happens when you take estrogen exogenously or HRT, hormone replacement therapy with estrogen, as you get older. There's a phenomenon known as the mask of pregnancy. The mask of pregnancy is a hyperpigmentation that occurs around the eyes that forms a mask. It's caused by excess levels of estrogen that happen when you're pregnant. If you're a high estrogen producer, and if you have a condition called PCOS, polycystic ovarian syndrome, I think we talked about that. Didn't we talk about that earlier?
Yes, we have.
PCOS, you'll also hyperpigment, and PCOS is partially an estrogen issue as well, although it's also a male hormone issue. All of which is to say, if you see it on the skin, it doesn't mean it's happening on the skin. In fact, Most likely it's not happening on the skin, and you've got to get inside the system. If you want just a quick cut to the chase in order to treat skin issues, you go back to the triangle. The digestive system, toxicity leaking into the blood will initiate a stress response, initiate an inflammatory response, initiate an immune response. Inflammation at the level of the intestine will compromise the absorption of vitamin A and zinc, which are two of the most important, although not the only two, but two of the most, and essential fatty acids, I should add, the most important nutrients for keeping the skin healthy: EFAs, vitamin A, and zinc, and to a certain extent selenium as well. They're all important, but those are probably the most important. If you have a gallbladder removed, you're in big trouble, because now you're not going to absorb your fatty nutrients, your EFAs, your zinc, and your vitamin A. Likewise, if you have a liver issue. If you have a second point in the triangle disease, dysglycemia, you're going to have elevated blood sugar. Elevated blood sugar will cause your insulin to go up. Insulin makes cells divide very rapidly. Elevated levels of insulin lead to hypoglycemia, which spikes cortisol, which will make your pores bigger and will also create issues with sebum. I forgot to mention, if you have digestive toxicity, you'll also have vasodilation in the skin, which will cause rosacea and redness and itching and allergic reactions on the skin. And if you have nutritional deficiencies secondary to gallbladder removal, gallbladder issues, or bile issues, or inflammation at the level of the intestine, you'll also have problems forming the skin barrier, which will lead to more skin health issues. And if you have insulin problems, you'll have excess growth or rapid division. By the way, one of the hallmark signs of elevated insulin or prediabetes or diabetes is skin tags. And skin tags are along the same lines of the rapid division of skin cells inside a follicle we call acne, except they're on the outside. And skin tags are diagnostic of diabetes or prediabetes. And then the third point on the triangle of disease, the adrenal thyroid complex. If you have excess secretion of cortisol, you're going to be more likely to have melasma or hyperpigmentation, more likely to have large pores, more likely to have excess oils on the skin. And if you have long-term chronic elevation of cortisol, you're going to slow down your thyroid. And because the thyroid regulates everything, once again, you'll end up with skin issues, including barrier disruption and hyperpigmentation, and most especially xerosis or dry skin, because the thyroid regulates the digestive system. Once you're hypothyroid, the whole cycle starts all over again, which is to say, if you have a skin issue, you do the same thing. You want to correct it, you do the same thing that you do if you want to correct your arthritis, your Alzheimer's disease, your Parkinson's disease, your autoimmunity, whatever. It goes back to the same thing. This is so simple, and that is our mission here. But it's my personal mission. It should be all of our missions as longevity distributors who are trying to help folks with their health. Simplify. Go back to the triangle. Digestion, blood sugar, adrenal thyroid complex, or super simplify. Just do the 2 points, the digestive system and the metabolic system, or the blood sugar system. Or super duper simplify and just go to the digestive system. And all the other problems, all the other health challenges will resolve themselves. By the time you see the zit, it's over. Just like by the time you see the rotten fruit, it's over. Your job is to get to tomorrow's skin or tomorrow's rotten fruit, which means go back to the soil, the triangle of disease. Now, I didn't touch on aging skin, but aging skin is along the same lines. It's degeneration of tissue, and wrinkles are arthritis of the skin. Arthritis is degeneration of the joints, which is connective tissue. Aging skin is degeneration of the collagen, the connective tissue in the skin, just like in the joints when you have arthritis. The degenerative process is generic. It's not special to the skin, although with the skin, because we have access to it more than we do to the joints or the heart or the internal part of the body, obviously, there's certain things you can do topically. The most important things you can do for your skin topically to keep it young and beautiful are the same things that you do for the inside of your body, which is A, stress, exercise. When I say stress, I mean eustress. EU means good stress. When we hear the word stress, we think of distress. That's the bad stress. Eustress is good stress. Exercise. You go to the gym, you tear up your muscles. What happens when you go to the gym and you tear up your muscles? Your muscles get bigger. What is that happening to your muscles when your muscles get bigger? You're tearing them up and they're releasing acid. The combination of disturbances in the muscle tissue plus acid generates more muscle growth, likewise on the skin. Exfoliation with low pH alpha hydroxy acids is the skin's version of lifting weights. It's the skin's version of going to the gym. So use alpha hydroxy acids in toners. If you go to an esthetician, they can do it in peels. You want low pH. That is less than the pH of the skin. pH of the skin is about 4 to 5. In there, you want a pH of under 3 if you really want to stimulate the skin in toners. And then immediately after you come home from the gym, you're going to be doing your vitamins, your minerals, your B vitamin, your vitamin C, your aminos, your nutrients, likewise with the skin. After you've exfoliated with the skin, you apply topical nutrition, especially topical vitamin A, as I said earlier, and topical vitamin C, but all the nutrients, many of the nutrients are going to be important for topical application. It's the same thing you do for the inside of the body, as always. That's for aging skin. And then internally for aging skin, for wrinkles, healthy bone and joint pack. As I said earlier, the healthy bone and joint pack is good for all the connective tissue, whether it's in the vascular system or in the fascia or in the skin. And so the healthy bone and joint pack ideally should be called the healthy skin pack or the healthy anti-wrinkle pack, because it does the same thing. You're building the connective tissue. And again, this demonstrates the simplicity of how we treat the body. It's only the medical model that has this confusing way of isolating individual parts and then naming them in Latin and fooling us into not understanding what the heck is going on. So we are condemned to becoming a ward of the medical model through surgical procedures or through medications. When you understand how this whole thing is put together, it simplifies everything. Yes, the skin it's not as significant as the heart when it comes to long-term health challenges, but it represents, or it is a portal to long-term health challenges that we can use to assess what's happening inside the body and that we can correct by treating the inside of the body.
I have some questions.
Yes,
and
ma'am.
we have lots of questions, Pharmacist Ben.
Yes.
I know you have a hard stop.
Hard stop.
So you said starvation. That's pretty simple. The body's not getting the nutrition. You said toxification, which those are toxic things that are causing toxification. What about suffocation?
Tricky.
Give us a little.
Yeah, let me give you a little on suffocation. First of all, obviously, when you think of suffocation, you think of air or oxygen. And you can go a week without food. You can go 3 days without water, but you can't go 3 minutes without oxygen. Oxygen, the need for oxygen is critical. When cells don't have oxygen, one of their coping mechanisms is to divide rapidly. Rapid cell division is a sign of low oxygen levels, whether it's happening inside the follicle or it's happening in an organ in the skin or in the body. And this is why cancer is associated with a lack of oxygen. So the most important thing to deal with hypoxia, it's called hypoxia, low levels of oxygen in the blood. Oxygen is delivered through the blood. So hypoxia refers to low levels of oxygen in the blood. So the fastest way to correct a hypoxic situation is to put oxygen into the system and breathe. Say, okay, well, that seems easy enough, but not really, because we don't really know how to breathe correctly. Nobody teaches us how to breathe. When we're young, we do it naturally. And if you want to really learn how to breathe correctly, watch a baby lay in the crib. I mean, a baby, not a baby that's already been, traumatized by life, but a baby who's just out of the womb. They breathe the way you're supposed to breathe. That's the way you're supposed to breathe, is like a baby. As we age and the impact of stress and trauma kick in, we learn to hold our breath. If you want a demonstration of this right now, think about something yucky in your life. Think about a bill or taxes or your husband or wife or kids or job or whatever, and notice how you're holding your breath for a split second. Rebecca, think of something you don't like. Do you notice how you hold your breath for a second? Happens to everybody. We hold our breath for a split second when we're going to rest. You'll notice this when you're merging onto a highway from a fast highway from a slow road. You'll notice that you're holding your breath for a second. You also notice you're contracting a little bit, and this happens to all of us. And it starts very young. As we age, we develop pockets of contraction all over our bodies. And these pockets of contraction make it difficult for the blood to move. On top of that, if we're subject to toxicity from the body and we're manifesting inflammatory responses, and there's lots of pockets of inflammation, again, it makes it difficult for the blood to move. So simple breathing is not going to get you all the oxygenation to the tissues that you need. One of the ways you can tell you're having issues getting oxygen to the tissues is if you're dealing with a condition that doctors call essential hypertension, which is very common. Essential, when it's put in front of the word hypertension, means it's hypertension that's just part of you. It's just natural. It's essential to you. There's no reason. We don't know why. Well, I'm going to tell you why you have essential hypertension. It's because your tissues aren't getting oxygen. And so the heart's trying to pump more blood. And so the pressure goes up. So as long as you have these pockets of inflammation and pockets of hypoxia from contraction, from long-term or from chronic stress, it's going to be difficult to push the blood, the oxygen through to the tissues. And so simple breathing is not enough, although it definitely helps. It's definitely important. And learning to practice breathing is extremely important. But also you want to work on all the other facets that are causing the inflammation and causing the pockets of toxicity, and that is the relaxation response, massage. By the way, people notice, you probably know this, massage therapists know this, that people will cry on the massage table. Why do they cry on the massage table? Because as they're being massaged, they're releasing these pockets of stress that have been, and contraction that have been formed over the course of sometimes for decades and a lifetime. And as they're released, you get a surge of emotion. And that's why people cry on the massage table. So massage is a great way to do it. Hot water, activating the vagal system, the parasympathetic nervous system, is a great way to open everything up. And so that's going to be very important. Also, and this is really important for people who are dealing with any kind of cardiovascular issue, heart disease, or any of these hypertensive issues or vascular issues, the heart's the pump. And by the way, that's a whole other story about whether the heart's a pump or not, but for now we'll say the heart's a pump. But you have a second pump. That second pump is one of the largest muscles in the body. And as this muscle moves, it pumps the blood, almost like a second heart. It's called your diaphragm. And so as you're breathing deeply and the diaphragm goes down and then comes back up as you exhale and down and up, you're pumping the blood. Anybody who has heart disease or had a stent or cardiovascular disease or hypertension should be practicing diaphragmatic breathing every day, because you're going to be pumping more blood without any effort, just by breathing. But also movement is important for moving the blood, particularly on the return trip. Remember, the heart pumps this way, but by the time it's got the return trip, there's not a lot of pumping action left. And so the venous system is dependent on muscular movement. And so movement, exercise, running, walking, riding a bike, all of these things are another way to improve oxygenation in tissue. So yes, breathing is very, very important. Slow, deep, rhythmic breathing. Don't underestimate its value, but it's not enough. You got to work on inflammatory pockets. You got to work on pockets of contraction, and you've got to work on supporting the movement of blood through the circulatory system, whether it's through the diaphragm or through movement, or through all the work on the first 3 points in the triangle of disease: digestive toxicity, which was going to clog the blood, dirty blood, sugar toxicity, which will again clog the blood, insulin, which will clog the blood, and cortisol, which contracts the blood vessels, causes vasoconstriction. So the 3 points on it's all the same thing, you guys. The 3 points in the triangle of disease, period. As far as oxygenation, your point is well taken. That's the trickiest one. You got to really work on the blood inflammation and hypertension to make sure that blood is getting through all of these clogs, if you will.
Okay, we have lots of questions.
Sure.
Let's go right over to Marilyn. And seriously, Ben, we have like 6, 7, 8 questions. So
here's the thing about questions. I love answering questions, but usually we get to 1 or 2 questions. That's because when you ask these questions, there's a lot of things to say. I can't just say, I could probably say, just take this or take that, but I always feel like I want you to know the mechanism. I want you to understand your body, understand how the disease process shows up. I don't like saying, just take this or take that. I don't want to be your authority. I want you to be your authority. I'm just here to show you how the whole thing works. So I apologize for being long-winded, but it's really important that we understand how the mechanisms work. And if you come on these calls enough, you're going to hear me saying the same thing over and over again anyway. So eventually, right? I mean, can you see how eventually it kicks in?
That's what people love about you, Pharmacist Ben, is you explain it so we can understand it rather than just take this for that.
Right. Okay, so, go ahead. What's the first one?
All right, Marilyn, what is your question?
Am I unmuted?
Yes, you
Yes,
are.
you're unmuted.
Okay. All right. I have a client and he wants to know your protocol from your mouth, but he's got congestive heart failure. He has amyloids or
Amyloidosis. Amyloidosis.
It's called H for hereditary, and it ATTR-CL, because CL, I guess, is referring to the heart. I looked it up.
Okay.
So he's got some excess proteins abnormal in the heart.
He's clogged up. He's deteriorating. He's degenerating. Amyloid is a protein. It becomes it disturbs normal tissue. The most common place where people have amyloid is where? Anybody want to guess where the common place where people have amyloid, where you hear about it all the time? What's the most common place where the amyloid plaques, so to speak?
Arteries.
That's not the most common place, but it can happen there. But Alzheimer's.
Oh.
Amyloid plaques in the brain. They want to give you vaccines now to get rid of the amyloid plaques in the brain. Amyloidosis is a common condition, and you can get amyloidosis or amyloid plaques in various soft tissues of the body. Amyloidosis is just fibrosis. Fibrosis is a repair mechanism. When tissue becomes deteriorated over time, the body will start to try to repair it as best as it can with fibers. Amyloids are one of those fibers, and amyloidosis is a generic bodily response to degeneration. The heart is susceptible to degeneration under conditions of starvation, suffocation, intoxication, because it's working really hard. So the heart becomes disturbed. The tissues begin to degenerate, and the body tries to patch up those tissues with amyloid. So amyloidosis of the heart, or amyloidosis cardiomyopathy, is just Alzheimer's disease of the heart. Alzheimer's disease is now said to be type 3 diabetes. It's the same mechanism. So don't be fooled by fancy Latin terms, and don't be tricked by this reductionist idea that we treat special organs specially. Our medical model treats this organ. You have a heart problem, you go to the heart doctor. You got a bone problem, you go to the bone doctor. You got a brain problem, you go to the brain doctor. You got a digestive problem, you go to the digestive doctor. You got a hormone problem, you go to the endocrinologist, blah, 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 blah. It's a system. The body breaks down as a system. And whoever has this cardiomyopathy, it's not hereditary. It's not hereditary. They call it hereditary because they don't know what they're doing. It's not hereditary. It's degenerative.
I told him that, and I suggested the body, brain, and heart.
It's more than that, because this guy's probably in his 50s or 60s, I'm guessing, maybe 70s. No children have this. Children
60.
Okay. He's had 6 decades of doing the wrong thing. I'm not trying to be mean here. I'm just saying this legitimately. So yes, the heart pack, absolutely. The healthy brain and heart pack, absolutely. It's a must. But you also got to do stop doing the things that are causing the degeneration of the heart. What's the most common, the 3 most common places, or the 2 most common places where degeneration starts? Digestive system and blood sugar system. Is this guy on the call?
I was hoping that he did, but I don't think he is.
So look, Psychic Ben, you've had digestive problems a very long time. I'm feeling it. I'm seeing it. No, of course I'm not Psychic Ben. It just happens. So this guy's had digestive issues a long time. By the time this happens, and 60 is relatively young, by the way, for this to occur. So that's good news and bad news. That means it's significant. That means it's been progressing for a long time. But it also means he's young. He can turn this around relatively quickly. So I would be doing, like you said, the healthy brain and heart pack for sure. But I'd also be working on digestive health, and I would be treating himself like a diabetic. I don't care if the doctor said your blood sugar is normal. It's not normal. It's not, or I should say normal. It's not healthy, because amyloidosis of the heart, just like amyloidosis of the brain, is type 3 diabetes. And any heart cardiomyopathy should be regarded as a dysglycemic condition.
He's in the hospital right now and getting diuretics because he's so.
By the time you get into a certain position, you may need hospitalization. You may need a stent. You may need a bypass. I don't know where he's at. I don't know how far down the rabbit hole he is. I don't know how far on the timeline he is. If he's right, if the timeline is here and he's here, yeah, he may need medical intervention. And so that's why I say there's times when you need medical intervention if you've been mucking up the system for a very long time. But that's not to say that you don't want to immediately begin to take corrective measures at the causal level. You know what I'm saying? So if you need a stent or bypass, ideally you don't want to have something destructive where they actually take something out, because then it ain't coming back in. You know, so hopefully it's not that significant. But if you need medical intervention because you've been doing stuff for 60 years or 50 years that have been mucking up the works, you may need to have some kind of palliation or symptom reduction. That's conceivable. I'm not saying no, but at the same time, you want to work at the causal level. In addition to palliating or mitigating the symptoms, you also want to work at the causal level so you can begin the reversal process. And that's the really great news about all health challenges, is between cigarettes, your lungs heal. Between gluten, your intestine heals. As soon as they put the knife in your body for a surgical procedure, your skin heals or your connective tissue heals. So this is the gift of the body. As soon as the assaults stop, the body starts to heal itself. So perhaps he needs medical intervention. I don't know that. He doesn't. But at least take corrective measures simultaneous with whatever kind of medical intervention you're doing.
All right. Thank you so much, Pharmacist Ben. Thanks for bringing that question, Marilyn. Let's move right over to Phyllis, bringing in questions from YouTube.
Yes, we have 2 questions here. The first one, Dylan on YouTube says, everyone says that you have to use sunscreen when you are using topically retinol and alpha hydroxy acids. What say you to that?
Is Dylan a guy or girl?
A guy, I think.
Very, very smart guy, Dylan. So thank you. And I'm sure you're young. Dylan sounds like a young name. So, you know, in the pharmacy, I could always kind of tell how old somebody was by their name, when they would call up. Like if they were Dorothy, they were a certain age, Barbara, Linda, you know, you could always tell people by their names. So Dylan sounds like a young guy. It's a good question, Dylan. If you use alpha hydroxy acids and retinol correctly, and you're healthy, it shouldn't be a problem. If you're using alpha hydroxy acids and retinol aggressively, you may want some sun protection, but I would use zinc oxide, which will heal your skin in addition to blocking the skin. And if your skin is not as healthy as it should be, once again, I would be using zinc oxide, which is healing as well as protective. But I would also be taking corrective measures to make sure my skin was healthy. And as we said earlier, there's lots of things you could do, particularly vitamin A, essential fatty acids, and zinc internally, and then topically, fat-soluble vitamin C is incredibly valuable for healing the skin and for protecting the skin from anti-aging. And I forgot to mention, retinol will lighten the skin for people who have melasma. Retinol and alpha hydroxy acids both have a lightening effect on the skin, but until you correct the underlying hormonal mediators and stress mediators that are associated with the melasma, it'll probably come back.
And then the other question is for me, milia, the little white.
Milia, great question. In fact, I just wrote a blog post on milia. If you want to go to my Truth Treatments Pro page, I have a bunch of blog posts that I post on there regularly. Also, Colorado Bestheticians, I post on there regularly. And I just did a post on milia. So that's a very timely question. Milia is rapidly dividing cells secondary to nutritional deficiencies, probably involving fat metabolism. So most of the people who get milia are either older women or babies. Babies will get milia when they have food allergies or allergies to infant formula. They'll get milia. And older women, more than men, sometimes men, but mostly older women, will get, and by older, I don't mean old, I mean older, will get milia when they're having either gallbladder issues, liver issues, or fat absorption issues at the level of the intestine. So you want to treat it as a fat malabsorption or fat issue. You can also unroof the milia with retinol. And that's on a daily basis. Or if you really want to go all out, you can go to an esthetician and they can actually poke it open and then use something like retinol to keep the skin cells dividing at the right pace. So it has to do with fat metabolism. It has to do with rapidly dividing skin cells. And really what it is, it's keratin, which is the protein that's produced by those rapidly dividing skin cells, in combination with the skin cells themselves that are plugging up the follicle. So it's protein deposits in combination with dead cell carcasses, all caused by rapid cell division, which in turn is caused by nutritional deficiencies, as well as likely hypoxia, low blood oxygen, and then also toxicity, sugar and insulin. Same idea as acne, but you don't have the bacteria present and you don't have the sebaceous secretions present. It's rapid cell division and keratin or skin protein without the sebaceous secretions in the bacteria.
Good to know. I'll drop off and see if we can squeeze somebody else on.
We'll get one more.
Okay, one more. Thank you so much. And Carrie, go ahead and unmute yourself.
I was wondering if Ben could talk a little bit about psoriasis and
Yes.
psoriatic arthritis.
Well, they're both the same thing, and it's a big topic, and I don't have as much time as I'd like to really tell you the whole thing, but just know this. Psoriasis is multiple sclerosis of the skin. Psoriasis is type 1 diabetes of the skin. Psoriasis is lupus and scleroderma of the skin. Psoriasis is name your favorite autoimmune disease of the skin. All autoimmune diseases are based in the same pathologies, same pathology, same in chemistry say etiology, which is a fancy way of saying cause. They just show up in different places. In the case of psoriasis, in the case of multiple sclerosis, the autoimmune disease attack occurs in the nerve cells. In the case of type 1 diabetes, it occurs in the kidneys. In the case of rheumatoid arthritis, it occurs in the joints. In the case of scleroderma, it occurs in the connective tissue. In the case of Sjogren's disease, it occurs in the glands. In the case of psoriasis, it's an autoimmune disease that affects skin cells. How skin cells divide is extremely regulated. You know, there's all this movement and dynamism in the skin right under our noses, and we take it for granted because here I am. You don't see any movement. You know, you don't see any dynamism going on, but there's so much action going on. And all that action that's happening at the tiniest levels, the levels of the cell, is tightly controlled, tightly regulated. Happens to just so. As soon as you go into nutritional deficiencies, as soon as you go into low oxygen, and as soon as you go into toxicity, starvation, suffocation, toxification, this disturbs the way cells move. It disturbs all cell chemistry, but particularly how cells divide. Psoriasis is caused by cells dividing really fast and not stopping until they form these lesions on the surface called plaques. So psoriasis is an autoimmune disease of the keratinocyte or the skin cell. Rheumatoid arthritis is the same exact thing, except it happens in the joints. One of the things about autoimmune diseases, they're like Lay's potato chips. You don't have just one. They happen in a constellation. You may see them sometimes just as one, but there's other things happening because the autoimmune disease, like everything else in the body, is systemic. It's global. It's the entire body. It's not just these targeted organs. And we got to get that kind of that image in our heads, that mindset that everything's happening as a system. It's not isolated organs because, and we have to, the reason it's important to really get in our heads is because the medical model has the exact opposite approach and we're immersed in the medical model. They want us to think it's the skin. They want us to think it's the heart. They want us to think it's the bone, not because they're bad people, not because they're evil people, not because they're malicious, not because they're stupid, but because that's the way the system is. And so we have to get it through our head. If you have a disease in one place, you have it everywhere, which is why I always say there's only one disease.
Dirty blood.
Well, that's the cause of the one disease. The one disease is MBFA disease.
Oh,
my body's falling
apart.
Yeah, that's the only disease. My body's falling apart. So psoriasis, it makes perfect sense that psoriasis and arthritis would go together, and they do. And by the way, psoriasis is the word for things that happen all together or diseases that happen simultaneously is called comorbidity. And comorbidities are a major clue to what's happening in the body. So arthritis is very frequently comorbid with psoriasis. Heart disease is very frequently comorbid with psoriasis. Cancer is frequently comorbid with psoriasis. So comorbidities are very frequent with all autoimmune diseases, including psoriasis. And it's perfectly logical once you understand the mechanism that it will occur in the joints simultaneously with the skin cells. So what do? I'm telling you right now, you can end it, your psoriasis, if it's you or whoever it is, and your rheumatoid arthritis today, simply by changing what's getting into the blood. Now, you're not an IV drug user, I'm pretty sure. So how else do things get into the blood? You know the answer. I'm not going to, I don't need to repeat myself. It's food. And you'll know. Did you say it was you?
No, it's Mom.
Okay, does mom notice that she has digestive issues? Long standing, by the way. Does mom notice that certain foods will trigger psoriatic plaques or trigger rheumatoid arthritis pain? Of course. So work on the digestive system, first of all. Secondly, fats are the major mediators of the immune system, the major control points on the immune system for all autoimmunity. Fats control the immune system. They're the activators of the immune system. And when I say fats, I mean good fats and bad fats, for better or worse. Good fats will quiet everything down. So she wants to be on good fats, essential fatty acids and fatty vitamins, and she wants to be avoiding bad fats, which are the processed fried fats and cooking her fats. And also, if she has any issues around fat metabolism, including the bile, including especially the gallbladder and bile, but also the liver and also the intestine and also the pancreas, which are other organs that are responsible for fat processing, those need to be corrected as well. So anytime you have an inflammatory issue, recognize that fats control the inflammatory system, and working to keep your fats clean by avoiding the bad ones and making sure you're getting the good ones and correcting fat metabolism or absorption issues is going to be important. And then also for autoimmunity, keeping the blood clean, as we said. You want specific steps? It's no accident that vitamin A and vitamin D are the main nutritional treatments. Even dermatologists know about vitamin D for treating psoriasis. Why? Because vitamin D controls the immune system, and it plays a very important, or I don't say controls, but it's one of the major controllers of the immune system. And vitamin A is one of the major controllers, as I said earlier, of skin cell growth, how fast skin cells divide. So she should probably be supplementing with vitamin A and vitamin D and getting out in the sun. That's the best way to get your vitamin D, along with getting on her ultimate EFAs, along with doing all the digestive support strategies that we talk about all the time, including food diary, elimination diet, and then all the wonderful longevity, digestive health supporting supplements, including the Nightly Essence and the Daily Digest. And Fucoid Z, even though we don't talk about it as a digestive health supplement, is collagen peptides can help. Both of them support the health of the intestine for folks dealing with leaky gut. And by the way, vitamin A is one of the most important supplements you can take for leaky gut also. So that'll give you that other benefit as well. And then do a food diary and eliminate the problem foods.
Good.
Okay.
Yep.
Great question. Pharmacist Ben, you're out of time, buddy.
I'm out of time. I'm way late for my meeting.
You are late. So thank you so much, Pharmacist Ben. And if I could get our crew today up on the screen with us. You know, we are a team, and Pharmacist Ben is one of the leaders of our team, and we greatly appreciate him taking time out of his schedule to be here with us on most Fridays. So Pharmacist Ben, thank you so much. We don't want you to be late for your next appointment.
I'm going to motivate. God bless everybody. Thank you so much, everybody.
God bless you as well. Thank you, thank you, thank you for another great Pharmacist Fridays. Folks, get back with the person to share this program with you. He covered so much today, and find out what is it that I can give my body to end that starvation, suffocation, and toxification. So there are some times where we need to detoxify the body, and the person that referred you to this program can help you with effective solutions to help you do just that. And if there is no one to thank, and you've never tried any of the products before, 855-949-3377. I have a team of certified holistic health coaches answering that number. Again, 855-949-3377. And members of that team include some of those that are here with us today on our crew for the Daily with Doc crew. And co-hosts, as I have Marilyn, as she's doing a fantastic job putting the information into the chat. So if you're here live with us, I hope you had that chat open. Otherwise, you missed out on a ton of information as she was doing dictation. Thank you so much, Marilyn. And Phyllis, she's putting more information in there as well, filling in a few of the little gaps and bringing in questions from the different platforms. As yes, we are a live show broadcasting on many different platforms. And if you want to join us live, You may do so by going to zoom.dailywithdoc.com most Wednesday, Thursdays, and Fridays from 12 to 1 p.m. Pacific, 1 to 2 Mountain, 2 to 3 Central, and 3 to 4 Eastern. And beyond that, ask your favorite search engine, what time is it in my time zone at 1 p.m. Mountain or 12 Pacific? So thank you so much, Phyllis, for all that you do. And Ruth Ellen, my executive production manager, who tries to keep us on straight. And she is also broadcasting and pushing out the broadcast to the different platforms, as you see with all the graphics. So thank you so much, Ruth Ellen, for all that you do. And we have Albert, who is letting people into the Zoom. So without him being our kind of our bouncer, our gatekeeper, people would not get in as quickly. So thank you so much, Albert, for all you do, as he is joining us from South Africa. And he is one of the main people who allow us to be 24/7 on our call team. So thank you, Albert. And we also have AJ, who has been very instrumental in helping us get on all these different platforms and keeps me on task to try to keep Pharmacist Ben on task. So, folks, you have been watching Daily with Doc and Becca. Thank you so much for joining us today. Again, get back with the person that shared this program with you and tell them thank you and what you liked best about the information that you heard today. Because, folks, you are an empowered individual. There's a lot that you yourself can do. And sometimes we just need that proper guide, proper coach to help us find the solutions that are working for so many. And it does come right down to nutrition, what we're putting in our bodies and what we're not. So again, get back with the person and share this program with you. If there's no one to thank, give us a call at 855-949-3377. And if you're one of those do-it-yourselfers and you've never worked with anybody and you've not purchased anything from Longevity, you may go to our website, dailywithdoc.com, and you will find a store there as well. My name is Becca Dukes. As the producer of this show and hostess, I'm also a certified naturopathic practitioner. Not pharmacist. I said that word too many times today. Don't want to go there. Certified naturopathic practitioner and a certified holistic health coach. And it is my honor and privilege as the Director of Student Services to provide this information to you for your own use. Bye for now. Welcome to Daily with Doc and Becca. This program is for educational purposes only. The statements in this program have not been evaluated by the FDA. The content is not intended to diagnose, treat, cure, or prevent any diseases, nor is it intended to take the place of your primary care physician. Testimonials are shared as individual experiences of the individual sharing their testimony. Results vary and may not be typical. We do not make any claims regarding health or income. As an empowered individual, you do have options available. We are honored to have a founding father of the science of epigenetics guiding us with the best options to obtain or maintain optimal health, Dr. Joel Wallach.